On today's ChatEDU Check-In, AI outperforms doctors on a clinical diagnosis study. Check-ins drop every Tuesday and Thursday, and don't forget to check out The Big Show with me and Matt Mervis every Friday. Today's story comes from NPR. So our first takeaway from this article is that AI reasoning models are demonstrating a high degree of accuracy using messy, real-world medical data. In a study involving Harvard Medical School and Beth Israel Deaconess Medical Center, an OpenAI model processed electronic health records from actual emergency department cases to identify complex conditions. The technology successfully navigated the triage and admission stages using the same limited information available to human physicians at the time. And overall, AI outperformed two experienced physicians and did so with only the electronic health records. Takeaway 2. Significant technical progress has been made in how AI handles diagnostic uncertainty and differential lists. Earlier versions of large language models struggled when faced with ambiguous symptoms or the need to generate a comprehensive list of potential underlying conditions. But the latest research suggests a turning point where AI can now match or exceed established clinical benchmarks and navigate thorny medical questions. This story on AI diagnosis has been something we've been following for the last 2 or 3 years, and there's definitely been some major improvements. However, takeaway 3 is that experts argue that superior diagnostic performance does not yet account for the complexities of a full clinical workflow. So while the model excelled at pinpointing a final diagnosis just from the text-based records, it lacked access to the nonverbal cues, sounds, and physical images that doctors use daily. So there is a distinction between solving a diagnostic puzzle and actually managing the long-term diverse outcomes that define real clinical medicine. So we are definitely seeing improvements in AI's ability to diagnose patients, but there still is a key part that is human, from understanding the person right in front of you and seeing the verbal and nonverbal cues. So we are going to keep watching this story, but this is a hopeful signal that AI diagnosis is going to help improve doctors' work, but not ever replace the doctors. What do you think? Drop us a comment, send us an email. We love to hear from you. Remember to check out the check-ins every Tuesday and Thursday, and then The Big Show with me and Matt Mervis every Friday.